Hello, my name is Rochelle Carney, and today I'm going to be talking about the 3 different types of professionals in occupational therapy. The 3 types are occupational therapy aides, occupational therapy assistants, and occupational therapists. Occupational therapy aides do not have to have a college degree. The requirement is a high school diploma, and they are trained by either an occupational therapy assistant or an occupational therapist on the job. So this position requires much supervision by either the occupational therapist or the occupational therapy assistant. They're trained for specifically designated tasks. The next position, which is sort of, I guess, a middle ground in between the aide and the occupational therapist, is an occupational therapy assistant. Occupational therapy assistants receive a 2-year associate's degree, usually from a community college. They are trained at the technical level, and they deliver services under supervision and in partnership with an occupational therapist. The occupational therapy assistant works directly one-on-one with the client. They focus more on doing and less on theory than an occupational therapist would. An occupational therapy assistant reports observations and discusses a client's progress to date and performs delegated assessments that are delegated by the occupational therapist. The next position is the occupational therapist position. This is occupational therapists are autonomous, meaning that they are free to make choices and they delegate responsibility to those under them, whether it is the occupational therapist assistant or the occupational therapy aide. They must have a master's degree and they are trained at the professional level. They focus on theory and evaluation. Occupational therapists are accountable for safety and effectiveness of occupational therapy service. They interpret data and develop intervention plans. Sometimes people get confused on the differences between occupational therapy assistants and occupational therapists. And I think I basically outlined some very clear differences, but I'm also going to talk about some things that they have in common. Occupational therapists and occupational therapy assistants are both considered to be occupational therapy practitioners. An occupational therapy practitioner is any individual who is initially certified to practice as either an occupational therapist or an occupational therapy assistant. And they are licensed or regulated by the state, district, commonwealth, or territory of the United States. And basically, they work together in a partnership. They collaborate throughout the intervention processes. So they work together as a team. And they both follow state practice acts, and they're both accredited by the Accreditation Council for Occupational Therapy Education, which regulates education for both. So I think initially they take a lot of the same classes when they're going through their trainings at school, and they both have to do field work. But the occupational therapist does do a bit longer field work, and they learn a lot more about theory. They learn a lot more about evaluating. So basically that's all I have for the different types of professionals. And again, that's occupational therapy aide, occupational therapy assistant, and the occupational therapist, which is in charge. So thank you.